My name is Dr. Anil Kamath. I am a senior consultant surgical oncologist at Apollo Hospital, Bangalore. Every now and then you might have come across a patient with a colon cancer or a rectal cancer with liver mets. The topic I would like to address is that can these patients be cured? Can a patient with a colorectal cancer with liver metastasis be cured? The simple answer for this, yes, potentially they can. At least in about 35 to 40% of cases, patients with colorectal cancer with liver metastasis can be cured. So how do we go about this? First of all, we'll need a correct assessment whether this is liver limited disease or whether this has gone beyond the liver to the lungs and other areas. For this, we may need a PET scan. Now after that, if it is a liver limited disease, we need an exact count. How many metastases are there? Where are they located? Basically, to see if they are potentially resectable. The other question that we need to answer is that if we go for resection, what will be the residual liver left? So if a resection can be achieved with leaving behind a safe amount of liver, then definitely cure is possible. Very often, we may not get such a situation. We may have a situation where the disease is limited to the liver but is fairly extensive, or patient has large metastasis or bilobar liver metastasis. In these cases, we have to go for what is known as conversion therapy. We may have to give the patient some form of treatment to see if we can reduce the size of the lesions. The usual treatment for this is to start with systemic chemotherapy. We take a sample of the tumor, send it for molecular profiling like KRAS, MSI and other such tests, and see whether the patient can be started on the appropriate chemotherapy and immunotherapy. After finishing a certain number of cycles, we might find that the size and number of the liver metastasis has reduced, and what was potentially unresectable may have become resectable now. So this is one approach. But this approach again may not always work. Sometimes we may have to go for other approaches. Like if one part of the liver has most of the metastasis and the residual liver is less, we can go for what is known as portal vein embolization, where we block the one part of the portal vein so that the other hypertrophies and become suitable for resection. Sometimes in a single sitting, removing of all the metastasis may not be possible. In these cases, we go for what is known as a staged hepatectomy, where we remove the primary, we remove the metastasis on one side of the liver, and those unresectable ones we address at a later date after giving further chemotherapy. Sometimes if the metastasis is deep and can't be resected at that point of time, we can place a needle and burn it by radiofrequency ablation. By this, what I want to conclude is that there are many methods available, and potentially any patient with a colorectal cancer with liver metastasis can be cured. Thank you.